Welcome everybody to our interactive webinar for nurse leaders. You are in Making a Big Splash, a system strategy to drive outcomes. We welcome you today. Right, a little meeting logistics. Everybody that's on the call, except for the presenters, has your camera off and your mic muted. If you have questions at any time during the presentation, please click on either the chat or the Q&A section, and we will be sure to get to your question once we get to the Q&A after the session. Our meeting agenda today, after we go through our welcome and introductions, we will do a brief sponsors message, and then we will get into the main presentation, Making a Big Splash, a system strategy to drive outcomes. We will hear from our presenters today about Prisma Health, how they got started using the Hercules patient repositioner, measuring the impact of Hercules, creating buy-in with the leadership team, and then some thoughts and some experiences around the project implementation. We will finish up today with a participant Q&A, and we will record the session and send the recording of the session to all participants following the call today. A quick word from our sponsor, that is us, the Hercules Patient Repositioner. Just a little background about Hercules. Hercules is comprised of three components. We see a caregiver pressing the button on the side of our first component, the drive unit. That is the box that sits at the head section of the bed. We also provide a mattress. We have 3 mattress options. And then our dream sheet, which is twice as long as your standard cotton fitted sheet. It replaces that sheet for 1 layer under the patient. Now we see the caregiver attaching the sheet using the sheet attachment strap. She is now clipping the sheet into the sides of the mattress to guide the sheet into the drive unit. Now she's pressing 2 buttons on the side of the drive unit to advance the sheet into the drive unit. We're ready to boost the patient with Hercules. You'll notice the head of the bed is raised. The covers are on the patient. It's very safe for the caregiver. It's a very comfortable experience for the patient. There's no lifting, no tugging, no pulling, safe for everybody involved. So it's a better patient experience. As you can see, it maintains the patient's dignity, and it's just an overall more comfortable experience. So now the caregiver is releasing the sheet from the sheet clips. She is pressing the sheet release button. She's pulling the sheet out of the drive unit. She's releasing it from the sheet strap. She will remove that sheet and place it in soiled laundry. Hercules fits on virtually all hospital beds, can safely boost patients up to 750 pounds. The nursing shortage has had a significant impact on the nursing practice environment. And as a result, we're required to do more with less. With Hercules, we're able to replace an unsafe physical task with efficiency through automation. The impact that you can expect from Hercules, an improvement in nursing retention. We will 100% eliminate all boosting injuries on beds that have Hercules. We will save an hour per nurse per shift. We will see a 50% reduction in infection exposure, a decrease in hospital-acquired pressure injuries, and an overall improvement of the patient experience. From a time-saving standpoint, in surveys where we've done over 5,000 surveys with bedside nursing over the course of the last essentially 10 years, we ask how many times a shift do you boost a patient up in bed? The average number that comes back in is 11 times per shift because we have caregivers that are boosting their own patients as well as helping colleagues boost patients. And so for manual boosting, this is an average of 7 minutes per boost. And what factors into that average is finding help, finding equipment, adjusting the bed height, adjusting the feeding tube, lowering the head of the bed, potentially putting that bed in Trendelenburg position, and then having to undo everything that you've just done. So over the course of that 11 times per shift, we're looking at 77 minutes per nurse that is spent on boosting patients up in bed. This is a high burden, low value nursing task where you compare that to Hercules, where it's literally 10 seconds to boost a patient up in bed, the same number of times per shift. It's essentially 2 minutes. And so what can we do with that more than 1 hour of time that we're giving that caregiver back? We can apply that to direct patient care. We can do charting. We can actually clock out and take a lunch, do some self-care, maybe leave our shift on time. From a patient experience, we're improving comfort. We're protecting the dignity of the patient. You notice the top cover is on, the head of the bed angle is raised to 30 degrees. There's a pillow under the patient at all times. So as a result, we're seeing an improvement in HCAP scores and Press-Ganey scores, specifically mentioning quicker response times, less pain for the patient. And then overall, we're seeing better clinical outcomes as that patient is able to be kept up in that up in bed safe position more frequently. We are proud to partner with Prisma Health to present today's session, Making a Big Splash, a system strategy to drive outcomes. Our presenters are Dr. Tina Ralyea and Celena Bearden from Prisma Health. And just a quick introduction on our presenters. Dr. Tina Ralyea has more than 40 years of healthcare experience. She is willing and eager to make new changes and advance care delivery systems. She has a strong focus on teammate engagement and exceptional care. She serves as the Midlands Market Chief Nursing Officer for Prisma Health. That includes Baptist Park Ridge, Richland, and Toomey hospitals. Her commitment to excellence is evident as she has led her 2 teams through the first magnet designation in the years 2020 and 2021, despite the pandemic. Tina's career includes clinical leadership in academia. Currently, she is a part-time professor at Northeastern University in Charlotte, North Carolina for the Accelerated BSN program. She is described as a lifelong learner. Additionally, she is active in professional organizations serving as past president of the International Clinical Nurse Leader Association, the Midlands Education and Business Alliance, and others. Tina has a strong voice for nursing and advocates for the profession. She's been married to Daniel for 34 years and has 3 children, Cecilia, Elizabeth, and John. Tina asserts that the journey has been a joy and it fills her cup. Celena Bearden has more than 28 years of healthcare experience, including 23 years at Prisma Health. She is a strong leader with the patient always being top of mind. She is often known to challenge thoughts, changes in the patient experience with the question, what would this decision look like if this were you or the person you love most? Her long-held belief is that excellence and quality care drives all other aspects of healthcare in a positive direction. Currently, she serves as the Associate Chief Nursing Officer for Prisma Health Baptist Hospital. Celena is most proud of the relationships she has throughout the profession, academically and within the hospital system setting, and is characterized as a true people person. She has been married to Doug for 23 years and has 3 children, Bennett, Brooks, and Katie Beth. Celena notes that her professional journey has been nothing short of a blessing beyond the imagination. Please welcome our very accomplished and dedicated nurse leaders and our guest presenters today, Dr. Tina Ralyea and Celena Bearden.
Thanks, Sean. Appreciate that a whole lot. And Prisma is really honored to be a part of the partnership and a journey with Morel and using your technology to really help us improve exactly everything that you shared in that ROI. We'll share some of our data in our short time and seeing those improvements. So just as we have meeting objectives all the time, and we want to make sure that the listeners can walk away with some positive outcomes, really, we'll talk about the Hercules. It's an automatic boosting technology, as you saw from the video. We may refer to it as Hercules. We may talk to it about the repositioner. All of those are exactly the same. But as we conclude today, we're hoping that you can really understand our ROI. What are some things that you can do if you're looking within your company and organization? What could you really add, and how important that voice of the bedside caregiver is? Also, then quality and safety, very, very important. Hopefully you can talk about 2 metrics and outcomes that you can add to that ROI, that teammate engagement, and then also have some consideration. Do you take and have it be one unit that you want to implement Morel and Hercules with, or do you go with a system-wide rollout? And we're happy to share how we got to a system-wide rollout that we're super proud of. So next slide. And particularly for Prisma, we're going to share a little bit of information. And as we walk through, we called it Operation Big Splash because it was early June when we were finally negotiating our final contract. It was swimming pool weather, and we were super excited. And again, we were making a difference, a big splash as well, not only from the swimming and the environment from the outside, but a huge impact on all of our teammates. So we'll walk through our process when we started in 2018 and why, what was the journey and the road we took, how did it grow, and then how did we get to that phased approach to have a big splash. So next slide.
So just a little bit about Prisma Health. This is obviously our leading vision. We inspire health, serve with compassion, and be the difference. And all of that we felt like encompassed what our ask was and what we were trying to do and accomplish through getting this repositioner and having it available for our patients and what it could do for them and even for our teammates. You can go to the next slide. So just really about Prisma Health, we merged as an entity back in 2017. It was 2 separate health systems that then came together to be a larger health system to serve South Carolina. We do have 12 acute hospitals and 6 specialty divisions. You can see the amount of 29.7 team members, employed providers, and inpatient discharges, outpatient, and all of the lives that we cover here in South Carolina. We were super excited back in June. The announcement was made that we're partnering with Blount Memorial in Tennessee. And so I think that becomes official December 1st of this year, although we've already started working through some of that and building those relationships and sharing, the things that we've done with the Blount team. We have 2,827 licensed beds, which is just really kind of important to note whenever we talk through the work that we've done. As you can imagine, that is a lot of beds. And so the best way to kind of tackle this project to ensure that we all get what we need and meet the needs of our patients and our team members as the same. You can go to the next one.
All right, so I'll take us back through the start of our 6-year journey. So in 2018 was when we had the first couple repositioners, Hercules. Again, I'll probably call them Hercules for the rest. It's just easier to say. So the company had reached out to several of the leaders and the clinical staff. Clinical staff had seen it, whether it be at a magnet conference or other critical care conferences. It was out there. Again, our staff became aware of it. They elevated it to the nurse leaders. The nurse leaders had also reached out, and again, they're great partners. They were able to come and do a demonstration. So great technology. They loved it. They wanted it. Everybody wanted more and more and more. But what we did was in 2018, the Heart Hospital was the first in the Midlands to take and get several Hercules to try and start using the technology. And then also in our upstate market, 2 of the community hospitals. And so they got 100%. But again, the smaller community hospital, Hillcrest, that was 44 beds. So if you can think about that, when we have an ask, we can't come forward and ask for 2,800 Hercules. It was much easier to get capital improvement. I think we're all faced with that limitation of capital. And how do you really pick and choose and demonstrate the return on investment so you can get additional units? So the small community hospital, and again, Hillcrest specifically, they're 44 beds. They were able to get 44 units and have it on every single bed. So we were able to look at their outcomes from at Hillcrest, and then also Greer was the other small community hospital that was 100% in the upstate. And then we also were able to, at a Coney, a third organization, they had about 75% of their beds with Hercules on. So by the time we got to our full deal and stuff, we had 243. And we were able to take and utilize the outcomes from those campuses to really justify the expansion. And again, Celena pointed out 2,800 is a lot of a difference to make from the 243 that we had in place. And capital funding limited. So that was a process to get our initial ones in. Staff loved it. So next slide. So the first was in October of 23. I was asked to present the system-wide approach. We were asking for the remaining 2,400 Hercules on our first go around for a capital request. Now, I do have to share the caveat that we did have a system CNO, and she actually retired October 1st. I was in my market role for about 6 months. And so the capital team had reached out to me and said, Tina, could you come do the presentation because our system CNO had retired? And, I asked a few questions like, what does the team know at the Capitol? You're sitting around a table with lots of executives and different disciplines, different CEOs. What did the team know about the Hercules? And they said, oh, they knew it. Most of them had seen it. They were aware of it. So I really just read the paperwork that was prepared by our prior system CNO, who again, she had worked very closely with that team and had been to the Capitol. And so I go in there and I'm going to admit it, I was ill-equipped. I did not have all the data. Like at that point in time, I did not even know that Hillcrest and Greer were 100% with their Hercules units. And so they were asking me very quickly then, what was all of those ROI? What was their pressure injury? What was their fall? What was their turnover? Every one of those elements of data for those two campuses. And I was like, I don't have it, but I will get it. I did go in with information because I had heard staff at the Heart Hospital in the Midlands say how much they love it. So I was able to share subjective data. I didn't have true information about this is truly the percentage of our nurses that say they love it, they have less pain, they would stay longer because they're utilizing that technology. And it was very clear that my individuals around the table that I was presenting to really did not understand the information as well as the equipment. What is the utilization? What is the difference in the impact it could make? So I have up there as the second bullet point, it was a clear no at that point in time. Come back with more information. And really, do we need 2,400 more units? Like, do you really put them on every bed? So my point of sharing that is it's important always, right? We need to have the right information and go fully armed with everything that you need to answer and address those questions. But if you get a no, don't have that be the end, because we can see the value and go back to the table again. So next slide. Yep.
So what we did next was really get our own data. Like if we're going to go and sit at this table and have this conversation, then let's be able to speak through and through about our organization and about what the data shows within our organization. So we did work with the Morel company and we did a survey of our staff and just found out where those pain points were. What drastic of an effect did it have on our team members? Would they consider leaving the profession because of some of the burden and the workload that they were experiencing? So we did a survey through 9 hospitals at the time, and just to see what the nurses were saying, and what were the voices of the nurses that we could then bring back and have that not only numerically speak to our data, but also their own words. What were they saying that may make an impact as we're trying to, establish that return on investment. And the numbers are always important. It lessens the opinion, it lessens the subjectivity, but I also think we can't underestimate what the voices, what they can do for us too, as we're trying to work through a process such as this, when we're trying to really better serve our patients and better serve our staff. So you can see always, often, have you ever felt sore or worked in pain as a result of the physical workload of a bedside nurse? Always 63%, sometimes 25%, and then rarely 12% prior to Hercules. And then after the Hercules, you can see the difference there, 63% to 4% in the always and often category, which is a huge difference. And then even go to the far other side, a 12% was rarely to now a 66%. Rarely, never do you feel that soreness and work in pain. And then the next graph, have you ever contemplated leaving bedside nursing because of your physical workload of your job? Very likely prior to Hercules, 46%, and then after implementation, 5%. Neutral state about the same. I don't think that speaks as much volumes as the very likely and the not very likely. So again, prior to Hercules, not likely to leave. Prior to is 24%, and then very unlikely after Hercules, 67%. So that went up, which is great. Exactly what we would hope that the data would show, given what we know and what we feel about the product itself that we had seen. Next slide. And so then again, just more data that we collected. Hercules has reduced the soreness, pain I experienced in my job. 92% strongly agree. And this is directly from our bedside nursing team. These surveys were done directly to our team. We really felt that that was very important to get that. And again, this data was important to take back to our finance team, our executive team, as we were, trying to advocate to get this within our system. Hercules has improved my response time in addressing my patients' needs. 89% agreed. Hercules has improved my job satisfaction. 91% agreed. Hercules makes me feel safer performing my duties in the patient room. 96% agreed. And then Hercules can help reduce burnout and my physical and mental fatigue. 92%. So great results, data-driven results on the first two slides. And the next slide, Sean. And then again, like I said, the voice of our team, data is so important and you absolutely have to have it. But what was our team saying? And we ensured to capture that as well.
Oh, no volume. Sean, I'm not hearing the volume.
And anyway, they are useful.
There you go.
Been a nurse in the ICU for at least 15 years, and these, a decade ago, were all the rage, right? And
overhead lifts.
Yep. I'm sure we spent a ton of money installing them in every room across the country. The problem is they're not efficient in any way. They are useful for a very, very certain population of patient. So if you have somebody who is very much a bariatric patient, you will take the time to slowly lower that thing and hook them up to their things and use it. This is by far and away in my career the best invention that I have seen for nurses, for bedside nurses, because not only is it effective, but it is efficient. And that's key because we're all doing more with less, so time is of the essence. And the ability to just lower the head of the bed, hit a couple buttons, and whoop, right up to the top you go, I think it's priceless. I'm also, wherever I go, one of the only men on the unit too. So naturally, it just falls on me, hey, Luke, will you come help me boost? And of course I will. So it's just me personally, it has saved a lot of grief to be able to up to the top of the bed. It's amazing. It's no longer a problem when a patient says, hey, can you pull me up? Because if I'm in a room alone and a patient says to me, can you pull me up? I want to say yes, but I can't do it alone. I have to go now and I have to find somebody else who also is doing something. And now I don't.
Thank you, Sean. I think you can go to the next slide.
Being a nurse and
All right. So again, definitely we had to get a lot of buy-in and stuff for the product and the capital expenditure, the expense and stuff. And so we all think of the COO and the CFO, but really I wanted to share, very important, we also had to get our clinical informatics. Whenever there's a new product that comes in, of course, they're worried, do we have to enter any patient information? Is there going to be any HIPAA and breach of confidentiality? This piece of equipment has no risk or harm to the company. So our CIO really appreciated that. We had tried the other materials and products, and high risk of breach is very much a major issue. Our therapies, physical therapy, occupational therapy, knowing that they could go in and get that patient positioned, sitting up higher in the bed, and ease for their mobility to get the patient out of bed, or even be working with them for their bedside range of motion, different elements. Respiratory therapists loved it as well. Again, think about the patient who's on a vent or a trach, or you're going in to do a treatment, and they're able to take and make sure they're in good positioning and getting the most effectiveness and benefit out of those therapies. We heard that the one layer on the surface, and then we use one flat sheet on top of that. Woundostomy, they were raving because now we've minimized layers and we're going to improve that skin care and minimize pressure injuries. Our transport team, they also loved it. Again, it's much easier to take a patient who's sitting more upright and moved up in the bed, moving them to a stretcher if they're moving the patient on a stretcher, or just to get them back into bed. And then patients, we heard the positive comments, how much they love it. It saves their dignity, just comfort, not being pulled at their arms to get boosted up into bed, or even, the sharing that they feel. So patients, families loved it, lots of positives. So we took all of those positive disciplines, really engaged the entire interdisciplinary team. And for us, we're very lucky. In our market here in the Midlands, our CEO is pro-nursing. He wants nursing to be able to do nursing care, and each of these therapists and different disciplines to have time to do the work that they're supposed to be doing. So he was very much engaged to really help us as we wanted to move the plan and the requests forward. So then we did have to go to our system COO and CFO. I put their names on there, Clarence and Matt. And so it was very different this time as we started to prepare what we were going to take and approach and take back for a second request. So we were able to share that video, and he was able to hear what was the impact. The video was actually longer. We had interviewed from all of those 9 campuses that were a part of the survey to take in, add comments and really talk about the strength. You had people talking about that they got their meal break now and how much time it did save. So from a CFO standpoint, he was thinking, right, incremental overtime, I can, get people to get their meal breaks, and I'm not going to be paying overtime and any of the ROI elements. So with that, we'll go to the next slide. So really, we're going to talk about, again, the narrative for the finance piece. When you have a large capital expenditure, say $10 million, they want to know what is going to be that return on investment, and, what's going to be the impact to the organization. So patient experience, and I don't know how I missed that bullet point. I thought of it last night, patient experience. And we are seeing that patients are loving the Hercules. And again, not having to be boosted by their arms or that discomfort. They do have a sense of improved responsiveness. They ask to be positioned. And so the nurse now is no longer waiting for 3 people to come. If we go back to the 750-pound patient, that can be done with one push of a button. So in the past, and currently, if you don't have this technology and you're in the patient's room, that nurse is waiting for 2, 3 more people to come help them. So now that nurse is able to do that positioning very quickly and promptly and improve that responsiveness. I can also tell you here from a patient experience, we do direct observation coaching. So what does that mean? The nurse leaders or the A&Ms will go in and we'll actually observe the nurse providing care, or the tech providing care. And we cover the 4 or 5 Ps, whatever your organization uses. And we really just step back and listen and monitor. Are they covering those important elements? And you can see the positioning is being addressed because it's easy. I can do it right away without waiting for additional people to come and help me. And the patient is definitely much more comfortable. Falls, and we're going to show you some data. So you probably say, how is it going to help with falls reduction? But think about it. If the patient's scrunched up and, down towards the foot of the bed and, you're all down like this, you're losing a lot of what is your normal trunk support and your muscle strength. So now with the patient being more upright, and they're able to even move more freely their extremities and, move their legs and not get DVTs, all of those elements, as they improve and increase that strength, they're able to get up and move out into their chair or, with assistance, get up to the bathroom. Mobility, they tie together. Falls, again, we want to maintain all their strengths. We don't want somebody just laying in bed, not being positioned properly, and not being as mobile as possible. The pressure injury, as I said, we've reduced layers of linen. Think about that 750-pound patient. If we go back to that scenario, how many draw sheets and heavy pads would we have under that patient so we could effectively lift and boost that patient? So again, now we're able to have the Morel sheet that's a part of the Hercules, and then we put one flat sheet over that to take and mobilize that patient. We don't have that lift and sharing. That's another thing. If you're lifting even a 300-pound person and there's a nurse on both sides of the bed, you're not getting that butt off the bed. You are actually sharing as you move and mobilize that patient, move them up in bed. Teammate, they're true to their word. They're going to support that. Really, there should be no injury from that lifting and boosting patients if you're using the Morel product, the Hercules, and just hitting that button. You don't get an injury from hitting the button. At least I don't know anybody that would. But it really definitely saves people's back, less pain. And then incremental overtime. We heard nurses are able to take their break, get their full lunchtime period. It creates now, nurses are able to do their standard work. If you're in the room to pass medications, the patient needed to be boosted, they are able to complete each of those tasks without waiting for people to come in and help, again, mobilize and move that patient up in bed. The reduction in risk exposure, we especially saw that through COVID. How many times in the past would we have had other nurses have to dress out into their PPE and then go in to help do that boost? Now, again, with that minimal, it could be one person in the room, that definitely decreases that risk exposure. Also to the finance person, where did his head go? I saved on PPE utilization. And then that teammate satisfaction, you saw that. Again, working with the Morel company, getting the survey completed, we were able to show objective data with the percentages and the numbers, and that satisfaction increased, and knowing it tied into retention as well. The nurses would stay longer with having this technology available to help the teammates. So next slide. So I just pulled, since we got our Hercules on some of our units here. This is the flagship campus here in the Midlands. So 10 East is a very heavy medical floor. And so when I look specifically at their pressure injuries, I went from January through July. They did get, and I'm going to put in the caveat, now we did get new beds, and I'm going to tell more of that story in a little bit. We got new beds as well as the Hercules. They came in together at the same time when we coordinated that process and delivery. And so they got their new beds in the Hercules on August 7th. So again, if we look January to July, they were averaging 4.57 hospital-acquired pressure injuries each month. And so August, September, it was 1.5 because they had 1 in August, 2 in September. And I'm very happy. I did look to make sure I can validate. In October, they had 0 hospital-acquired pressure injuries. So again, phenomenal work. And we are definitely seeing that direct observation coaching. Patients are being positioned. And again, the beds did play a little bit of a role in that as well. So a win for 10 East as one of our examples. And then when I looked at our fall reductions on 11 East, that's our nephrology floor. So when you look January through July, they were averaging 4.86 falls each month. And then they also got their beds right in the August timeframe. That's when all of our beds started being delivered for Med-Surg with the Hercules. So August through September, they had 2 falls per month. It was actually 0 in August. They did have 4 in September, and they had 2 in October when I validated their data. So they would remain at like a 58, almost 59% reduction in falls. Again, really tying it to the nurses are able to better mobilize our patients and really help them with their positioning and helping them keep what is their current muscle strength when they come in, so they're not becoming more debilitated lying in bed and scrunched up towards the foot of the bed. So next slide.
So then how did that speak to our data related to our workforce? Rochelle, I read your comment in the chat. You could not have teed me up any better. We actually did see a positive increase. For here in the Midlands market, each of our University of South Carolina, our biggest nursing school right here beside us, at least every student will go to one of our campuses one time throughout their clinical experience. So what we saw was, just as Rochelle says, she's exposed to it as a student nurse, and then perhaps goes and works at another organization or within another facility and can kind of see the difference. So for our data specifically, you can see the difference of about 75 new hires from September of 2023 to September of 2024. And, you know, that also included experienced nurses. It is very attractive. It does speak to the investment that our organization has made in us as the workforce for all of the reasons why Tina just said. We were able to reduce agency. Again, if you go to September of 2023 and we have 512, to September 2024 and we have 320, all of those ROIs speak right to the heart of a finance team member. And then our turnover rate, 18.7 down to 15.2, and all of the little bullet points that Tina talked about for the staff satisfaction, for their well-being, all of that speaks to what we're able to then see that translates into our workforce dashboard in a positive direction. So that's been really cool to see, and something that we are proud that to have and to be able to put that into place for our team members. Next slide. And then I know Tina sort of alluded to it with our CEO of our market. He is heavily driven by the performance improvement. Everybody has skin in the game. We all own something. If we can ensure that everybody's doing their part in what that patient experience looks like, it gives everybody the opportunity to function at the highest level that they can. We call it the pancake syrup mentality. He has coined that very nicely. And just really that mentality that if a patient has their pancake syrup on their tray every single time that they've ordered that, and the nurse doesn't have to go out of the room, get the pancake syrup, come back in the room, that the nurse then is able to be in that room and focus on the, you know, the things that matter, the bundles, the CLABSI bundles, the quality bundles, all of the things that the bedside nurse has to do. And again, that whole, we're doing more with less. So if a nurse is able to stay in the room and position their patient without having to bring yet another team member in there, that is a huge win. And so we really felt like utilizing the repositioner, having the Hercules in place, allows our team to do just that, to be at the bedside and to be able to do what they need to do at that time for the patient. And I will just add, and this is a little off script, I was able to do some leader rounding this morning, and ironically, one of our team members has recently had a baby on our campus, and she is from the finance department. And she shared with me this morning that she had her C-section and came out to her bed, that they were going to then be taking her to the couplet care unit. And the staff, one of the staff members said, "You know, she works here, right?" And they're like, "Oh, no, I didn't. Where do you work?" And she said, "I work in finance." And they said, "Oh my gosh, are you responsible for getting us the beds and these cool repositioners? Watch this." And so they showed her how they could move her up on the bed. And this was her second C-section. And she was like, "I wasn't able to do that the first time. That is so cool. That's so much easier than having me scoot up after just having a fresh C-section." So it really is cool to be out and about with our team and hear really how all this hits home and affects them in such a positive way. You can go to the next slide, Sean.
All right. So very important. We wanted to really highlight that the Morel company really has established a strong partnership. They have been here on the journey, 6 years ago, really evaluating and helping what units is probably the best to start with. And then the important thing, and that's frequent meetings. I can tell you, Brad and Meredith are my two strong partners that I work with very closely. And so they would reach out. They were on our campus, making sure whoever had the Hercules was using it properly. I saw them in when there was new staff. Maybe a unit had 6 new graduate nurses starting. Like, they wanted to come in and make sure that they also understood the technology and that they were going to be using it appropriately, saving their backs from right off the start. So yes, Rochelle, helping our students to make sure that forever you would use the equipment correctly. There was ongoing communication. They, again, email, text, on site, very, very visible and flexible. There were some times when we were in meetings 3 times a week just to make sure. And again, if you go back to when I had asked in October, again, they were here, they were a partner with me trying to say, could we maybe do a lease and get another unit to have 100% of the Hercules on their unit, and we can get another unit to demonstrate those ROIs. And there were times when Brad would say to me, "When am I going to get a chance to talk to your CFO and COO?" And I kept reminding him, "I'll let you know when the time is right," but it's not yet. I knew that we were getting $40 million of beds and that we needed to make sure we were coordinating all the pieces. And I wanted it to be yes the next time I went back to the table. And again, just really collecting all that information. So Meredith and Brad were helpful again in the survey, making sure I had all of the NDNQI data. They went and walked room by room to validate if some, like Hillcrest, they were supposed to have 44. Were there any that were broken down in the basement or broken beds down in a basement? And then we were putting beds up there that didn't have the Hercules on. Again, so true partners and advocates. I cannot talk enough about the relationship of really just, we're in this together, and they also see the value for the patients, and they want to help us be successful in each of the outcomes that they have guaranteed from utilizing the product. So next slide. So when is the right time? Next slide. So really the tipping point and stuff. So as I said, we did invest $40 million for beds across the entire system. And so quickly, again, working with Brad and Meredith, I'm like, I need some quotes. I know that we want our current existing Hercules to stay within and get placed onto our new beds. They had gotten me quotes for whatever that cost would be. And so we worked together, and, I reached out to the CFO and COO, and I said, "Hey, I think it's time for us to really talk about the Hercules again." And so reaching out to Brad, Meredith, they helped. Together, we came fully armed this time with all the pieces of information, being great negotiators and partners and stuff. What can we really do to get as many? And I really want to highlight, right, in the beginning, the ask was going to be for all 2,400 new Hercules for so every single bed. But this time I sat down to Brad and I said, we're already investing 40 million. I'm not sure we're going to have, enough to get the full 2,400. What do we really need? And so this just shows their demonstration. Some people would say, "Oh no, you need them all," right? They want the sale. But they really sat down and said, and we walked through every single unit. Pediatrics, you don't need it for every pediatric patient. Now, we did give them about 6 because they do have some, 14-year-old CP patients that are obese, and this certainly would help them, or whatever the scenario is. But we walk through, and even every postpartum, I'm so glad that that financial person did have a Hercules on her bed. But we realize there's many postpartum patients that really don't need it as well. So they helped us get to what was that right number to have a reasonable ask. And we were able to get in front of, and this was really quick, guys. So we were able to get in front of the CFO and COO, and really in about 2 weeks, we were able to truly negotiate that it made the most sense now to put them on our new beds exactly when the new beds were coming in. Now, our new beds were coming in 2 weeks later. So we had to really coordinate and work so closely together. What we decided up front was, let's take and put them on every med-surg bed as those beds came in. That gave us from the end of June, when we finalized all of our negotiation, to give us to August to start putting them on med-surg beds. In the meantime, from June until August, we did receive our critical care and our OB beds, which right now we're in the process now of going back to make sure we have Hercules placed on all of those. But I cannot speak enough about the value. So I do want to talk a little bit about how did we get to the big splash? When we were able to go back and look at those units that were, couple, in the heart hospital, maybe one of the units had 6, one unit had 12, but none of them had 100% of the Hercules equipment. So when I was presenting the ROI for those units, I couldn't really prove a lot of the good data and outcomes, because who has one ready when you need that patient to come? As well as the heart unit that has a Hercules, the patient goes to the OR, say, when the patient comes back, they may not be on that bed. So we knew that we needed to come up with a strategy of making sure that the units were 100% equipped with Hercules, and made sure it was available for all the patients when they got there, so that the patient who absolutely needed it would have it there and available for them. So again, that's how we got to really that big splash, being able to put them on our new beds at the same time that the beds were rolling in the door, as well as making sure that we could see each of those ROI elements that I did share earlier. So again, it was a game changer. So the staff love it. We heard even the patient from this morning that Celena shared. That was a great story, but it's been transformational. And again, the partnership has been amazing, and I'm looking so forward to what fiscal year 25 holds for Prisma Health and our continued partnership. So next slide. I think it's just questions. So with that, you have to type your question into the chat, and we're happy to address any of those. Gonna switch over and see that. All right, so from the survey, some of the statistical differences, I think that if we went back to that, you could see that the numbers were markedly higher, that the staff really feel the value of having the Hercules. They can go home less exhausted from all that lifting, as well as they were getting their breaks. Their satisfaction increased. I will tell you, Prisma, we have increased our patient teammate engagement scores significantly over the past year, and I'm confident that we'll continue to see that improvement as we've expanded the Hercules across the system to much greater numbers. Hopefully that answered your question. And then the next one is from Lori. So please speak to the issue of turning. Hercules does not reposition or turn the patient. So I will speak to that. So actually what happens is they can boost the patient up. So it does elevate and boost the patient. But now typically it might be a tech that comes in and can help move and put the wedge under. We have taken making sure that that turning does still occur. And sometimes, honestly, the patient does get boosted up. And if they're able to put their arm over in front of them, the nurse independently still can take and do a little bit of that positioning. It's much easier than a patient that's curled up at the foot of the bed. So, Celena, have you heard any comments too? I know that there's a little bit more independent boosting with that one nurse as well.
Absolutely. Whereas before, you had two people in there to reposition, you can still do that now independently. Like you said, when you're all the way down at the bottom of the bed, then you first have to get them pulled up to the top of the bed and then positioned to turn. And that decreases that need to do so just a little bit more with the Hercules in place.
And then the next one is related to disposable. And actually, we do the laundry sheets. We do work with our linen vendor, and they just go in the regular linen, and they do take and launder them and bring them back. So, and I'm not even sure of the pricing. That's how we had started 6 years ago, and we kept that journey, and we do not have any issues or concerns. And then Rochelle did answer that there is some turn assess, but it's slow.
Yeah.
So, any other questions?
Last one, the burden of separating linens when you have Hercules and non-Hercules beds.
There is no burden. We put it all in the same. So again, for us, we have reached out to our linen service and company that we use, and they launder them and take care of all of that for you. We do have some ceiling lifts, but we're not using them now that we do have the Hercules. This has really replaced it. That video you could see, we have them in all of our ICUs. We have some in our bariatric units, various places. But again, we have had to minimize. We did hear that from the ceiling list, making sure they were on the charger correctly. You'd go to use it, it wasn't charged. So this has been a major transformation for the staff to always just be able to hit a button.
Was there a benefit or value of having seen since implementation of Hercules that you either didn't initially expect or didn't fully appreciate would be at the level impact you've actually seen since adding these to your units? So I think I would say for my campus specifically, there were team members that didn't even know this existed. They had never seen this. So for them to have this product, show up and the ability to position their patients so much easier was just like Christmas morning. I think we did not realize how much our team members would be so excited about. I mean, you kind of hate to say one little thing, but again, one little thing, we hear so many different things related to team member satisfaction. And I don't know that any of us would have ever said a repositioning mechanism would have been at the top of that list. But I think hindsight, if I could go back and resurvey our team to say, what has been the biggest impact, what has brought you the most joy over the last year, this absolutely would be on the list. And we hear that through the halls. And it did make me giggle that they told the finance person that they were going to take top-notch care of her because she was part of helping them be able to get this into their areas.
So Blount Hospital is asking about reduction in teammate injuries and workman comp cases. So as a whole, really the majority started arriving in August. So, and you're part of the system now too, very soon officially. So we'll be happy to share all of that, and we'll continue to collect that as well. I know we are starting to see a little bit of a reduction, but I'm not sure if it's 100% just related to lifts. And that it might be slip, tripped, falls, or needle sticks, or any of those other elements. We are seeing a little bit of a downward trend of lost days and restricted days. So, but again, I don't have that data broken out in correlation yet, but I'm sure we will do that specifically as we continue on our journey, and we'll share it. Yep.
I
Any
agree.
other?
That's what we just saw. We
Yeah.
reported on Tuesday. We saw the same thing, but we have not deep dived into the actual reasons, but we've seen a decrease as well.
Well, we're super excited to get the rest of them. I know our ICUs are waiting patiently. I believe they start right after Thanksgiving to get them installed in our ICUs and in the rest of our OB labor and delivery beds. And I cannot say enough again. Thank you, Sean. Great partnership, your team. And we love working with all of you, you know.
Well, thank you, Tina, and thank you, Celena, for walking us through your experience with Hercules, sharing your insights, sharing your expertise. For everybody that is on the call, we will follow up this call with an email with a survey, as well as a link to the video of the presentation. We thank everybody for your time today, and especially our presenters, Tina Ralyea, Celena Bearden with Prisma Health. We are signing off, and thank you again.
Thank you.
Thank you.